We keep hearing about so many methods out there, and some of them are more, more preferred or favored by the general, say, healing profession than others. And I would like for you to explain what is the difference, or what is the approach between CBT, cognitive behavior therapy, and resource therapy.
Yes.
How do you see the relation between the two?
They're very different.
Okay.
Very different. There's three main psychological approaches: the cognitive behavioral movement, the phenomenological movement that's person-centered and Gestalt and existential, and the psychodynamic movement, which where resource therapy falls into. The psychodynamic movement believes that things happen in the past that can be worked on through memories of the past or memories that the person's holding that can have an impact, a positive impact on the current, the present.
Yes.
CBT doesn't hold that at all. CBT accepts that things happen in the past that affect us today, but CBT says you never go to the past. You never revisit the past. You work on reframing how the person is thinking, and you work on giving homework, changing what the person does, and build on top of the issues of the past, coping skills. And my issue with that is there can be a trauma being held by a state. A state can be quite traumatized and feel like it's going to die, feel like it isn't any good, it's rejected, and in CBT that's never addressed. In CBT there's just coping skills given to the client, and that trauma is left there. So in resource therapy, we go there and we make sure that state feels supported, safe, and is in a positive space, so that it frees it to become a reintegrated part of the personality, and it allows the person to be more free, and the symptom totally disappears.
So, taking this idea into account, conscious mind, subconscious mind, we could also say that CBT works more on the conscious level, whereas resource therapy or psychodynamic therapies work more on the subconscious level.
Well, yes, in a way. CBT does work with what I call surface states that are conscious most of the time. In resource therapy, we bring to the conscious states that may not have been there for a while, and that may have been more subconscious, but we're constantly working with consciousness. We're constantly working with the state that we brought to the conscious, and that's very empowering for the person.
Thank you very much.